This is Dr. Daniel Paul, orthopedic doc with Easy Orthopedics, and today we're going to talk about is if you should be concerned with degenerative disc disease. If you like this video, we put out new content weekly, so please like and subscribe. So degenerative disc disease, maybe you had back pain, you went to see your doc, primary care doc, ortho doc, they get an x-ray or an MRI, you get the report, it says, oh, degenerative disc disease at, L2, L3, L4, L5, L5S1, we're in the neck in multiple levels. And you go, oh my gosh, I've got all this degenerative disc disease. And so, is that important? And in my opinion, most of the time, no. Okay, and here's why, right? As we get older, our spines degenerate. Now, that doesn't necessarily mean have pain. I mean, radiographically, X-ray, MRI, you're going to see degenerative disc disease. And they did a study where they found people who didn't have any back pain, and they just got MRIs, and they found that as they got older, especially into their 70s and 80s, they had terrible looking spines, tons of discs, arthritis, degenerative disc disease, and it didn't matter. So nobody has a normal MRI of your spine where just MRI comes back as normal unless you're like under 20 years old or under, right? So as we get older, you're going to find that. So sometimes that's the cause of if you do have pain and you do have degenerative disc disease, is that the cause of your pain, or is it coming from the facet joints? Is it coming from a disc? Is it coming from the muscles? And I think that's what makes back pain so tricky to treat and why so many different types of people do, is because it's hard to pin that down. But, if you have, if the degenerative disc disease is really severe, where like it's bone on bone and the bones have moved, then yeah, that can certainly be a pain generator. But just run-of-the-mill degenerative disc disease, I don't get too excited about it. If there's no pain running down their legs, it's not pushing on a nerve, I usually most of the time ignore it and try to work on musculoskeletal, muscular issues before we get to that aspect of it. So, the long answer is that it depends. But for the most part, everybody has it. So it could be causing your back pain, but most likely it's incidental. So I hope I was able to answer your questions about degenerative disc disease. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice because this video and all my videos are for educational purposes only. Thanks for watching.